This Medical Minute, sponsored by Avera.
September is National Suicide Prevention Month. So what should you do if you suspect that a loved one or a friend is considering suicide?
Eric Thorstensen spoke with an expert on this very tough subject for tonight's Avera Medical Minute.
Well, joining us now, Thomas Otten, the Assistant Vice President of Behavioral Health Services at Avera. Thanks for joining us today, Thomas. First of all, what are the warning signs of suicide?
Yeah, there's several warning signs for suicide that people can really look for. Certainly, depression and suicide often go hand in hand. So if you look at the signs and symptoms of depression, they often will mimic those of suicide. So you're looking for people who are feeling hopeless, feeling helpless. Sometimes it's things that used to give them pleasure, they're no longer interested in. Withdrawing from things, and real changes in behavior. Sometimes it's sleeping too much, sometimes it's not sleeping at all, but significant changes in behavior is certainly something to be paying attention to. Lastly, it's just talking about suicide, or talking about wishing they were dead, or feeling like people would be better off without them here. Those are some really important classic warning signs to be looking out for.
How do you ask the question if you think someone is considering suicide? What shouldn't you do?
Yeah, so it's generally you start with asking questions about kind of how they're doing or where they're at. Where you need to eventually get is you need to get to the question of, are you having thoughts of suicide? It's not just, are you having a tough day? Are you having thoughts of hurting yourself? But really naming it what it is, and are you having thoughts of suicide? The research is extremely clear on this, that you asking that question will not plant the idea in somebody's head if they weren't already thinking about that. And if they were thinking about that, it gives a perfect opportunity to open a door for an honest conversation and get them to the help that they may need.
So what should you do if a person does say, yes, they are contemplating doing the unthinkable?
Yeah. So the first thing to do is never show shock. I would say always be prepared that their answer to that might be yes. And then you just help them along the way. You need to get them to the resources and staff that can help them. The first that I would mention is 988. It's a national suicide hotline across the country. Any state you're in the United States, that will ring to a suicide hotline in your local area, and they can talk you through those situations. The second is, if you're in this area or you're around Sioux Falls, a lot of times what they're going to recommend is that you come to the Avera McKinnon Behavioral Health Urgent Care. 24 hours a day, 7 days a week, we are here waiting to serve you.
Well, Thomas, thank you for joining us today.
Absolutely my pleasure. Thanks much.
This Medical Minute, sponsored by Avera.
For more information on suicide prevention resources, head over to avera.org/medicalminute, and we will be right back.